Good day everyone, my name is Chris Daniel Sumamang from BSN 1B, and for today I will be conducting an assessment on the nose and sinuses. So for our first step, we need to assemble our equipments. We do need to have a pen light or a nasal speculum. Next is we need to introduce ourselves to the patient, and we need to verify the patient's identity. And also we need to explain the procedure with the patient and assess whether the patient has the ability to assist with our procedure. So, hi sir, my name is Chris, and for today I will be your nurse. May I know your name?
Raver Hipolito.
Sir, may I see your name tag? Okay, thank you sir. So for our next step, we need to perform hand hygiene. And other appropriate infection control procedure. So for our next step, we need to provide the patient some privacy by closing the curtains or around the bed, or closing the doors to room if possible. So for our next step, we need to inquire, or we need to ask the patient some questions about the if he or she has a history of the following. If he is having an allergy, difficulty in breathing, sinus infections, a injury on the nose, on the face. Next is if he or she experiences nose bleedings, and if he or she is taking any medications, and if there are any changes in the sense of smell. So now let us proceed to our assessment, or the assessment of the nose. First thing that we need to do is we need to inspect the external nose of the patient, and if there are deviations, shape, size, or color, or flarings, or discharge from the nares. Okay, so for our next step, we need to lightly palpate the external nose to determine if there are tenderness, masses, or displacement of the nose or cartilage. Next is we need to determine the patency of both the nasal cavity. So for our next step, we need to ask the patient to close his mouth, and we need to exert the pressure on the nares and breathe through the opposite side of the nares. Next is we need to repeat that procedure to assess the patency of the opposite nares. So sir, can you please close your mouth? And we will now exert some effort, exert some pressure here, and may you please breathe. Okay, the other side. Okay, so for our next step, we need to inspect the nasal cavities using a pen light or a nasal speculum. So for our next step, we need to tip the client's head backward. So please, may you please tip your head for a bit, and we need to next push the nose tip backward, and we need to direct the pen light to the client's nose. We need to use our non-dominant hand when assessing the nose. And also for our next step, we need to observe some presence or redness, swelling, growth, or discharge. Okay, thank you sir. So for our next step is we need to inspect the nasal speculum between the nasal chambers. Okay, so we will now proceed to the assessment of the facial sinuses. So for our first step, we need to palpate or percuss the maxillary and frontal sinuses for any tenderness. So sir, are you feeling pain right here? No? Okay. We will now proceed to our next step. If the patient experiences tenderness on the maxilla or the frontal sinuses, this would suggest that the patient has a sinusitis, or if so, we should provide or perform a surgery called the transinulumination, or if necessary, if the patient is in good condition, the procedure is not necessary. So now let us proceed for our last step. We need to document our findings to the client's record. So for our evaluation, the patient was assessed accurately without any injuries, and the patient only experiences minimal discomfort. So for our documentation, we do need to record our findings to the paper or flow sheet or the computerized record, and we need to report abnormal findings to the appropriate person, and we need to identify the site of assessment if other than the nose. That would be all for the assessment of the nose and sinuses. Thank you.